Great. Over to you, Jill.
Hey, thank you so much, everyone. Well, first of all, hope you had a wonderful Thanksgiving. Ate way too much, but stayed socially distant, of course, this past weekend. And we're really pleased to have all of you joining us for our final webinar of the year. As Craig and I were talking a little earlier, who would have thought at the beginning of the year when we were still doing in-person workshops that we would be going virtual and online? But it has been a wonderful partnership with the Cyber Readiness Institute to be able to help so many businesses and organizations and individuals as we've had to be very adaptive and nimble in trying to be both safe for our health purposes and cyber safe as well with our digital presence. So today's webinar is especially critical given the fact that we want to not only keep ourselves apart to prevent the spread of COVID-19, but also need to maintain our health as well. And many in our CyberHawaii universe, a lot of our members and partners, this is part of their daily life to make sure that people have access to health throughout our state, but also need to make sure that our digital self, as we said, is secure as well. So first, what we want to do is send a really big mahalo out to all of our community partners who have been helping us with all of these webinars, and especially today. The Small Business Development Center, great partner, the Hawaii Island Economic Development Board, the Maui Economic Development Board, the Hawaii Business Roundtable and Hawaii Island Chamber of Commerce, and especially for this particular event, but has been critical in our community on the front lines these past 10 months, the Healthcare Association of Hawaii. So mahalo to all of them for helping to make this webinar possible and sharing it with their members and their community. And with this, we would love to go ahead and get started. We have two amazing Cyber Hawaii members participating today. No stranger to you, Alan Ito, the CISO for Hawaii Pacific Health, and Robert Walker, Program Director for Ekahi Health. So big mahalo to these Cyber Hawaii members for sharing their expertise and their advice today. And with that, we're going to hand it over to Craig Moss, our wonderful partner, Director of Content at Cyber Readiness Institute, to get us started. So, Craig?
Great. Thanks, Jill. And it's a pleasure to be working with you again. We love doing these sessions with our friends at CyberHawaii. So, and I really want to thank Alan and Robert for joining us too. We had a great prep call, and we think this is going to be a really interactive and engaging session. So we're going to go over some of the challenges for telehealth. We're going to go over some basic steps to reduce cybersecurity risk related to telehealth, and then to talk a little bit about how to develop good cyber habits in an organization. Because no matter what kind of organization you are, you have people in it, and you want those people to be able to develop some good cyber habits. So quickly, a little background on us. We are a not-for-profit. We bring together global companies and really focus on small, mid-sized businesses in the value chain. All the content that we develop is free. And I'm going to give you a quick rundown on some of the content we develop. So a lot of the things that we talk about are available on our website. It's all content that is available for free. And you'll see our website at the bottom. We have cyberreadinessinstitute.org, which is long and really easy to make mistakes when you type. So we also have becyberready.com, which is a lot easier to type. We're supported. The way that we can get all this great feedback content to you for free is that we have support from these organizations, and they provide the funding that enable us to develop the content to be able to provide it to you for free. It's not a freemium model. We're not giving you things now to try to sell you something later. Everything we produce goes out for your benefit. And so we want to thank all of these supporting member organizations. So here's the content that we produce. We have a cyber readiness program that engages an organization to pick a cyber leader and help that cyber leader to develop a better culture of cyber readiness in the organization. We have a lot of short guides and tips: telehealth, remote workplace, hybrid workplace, all things that are really quick, 1 or 2 pagers that give you some do's and don'ts. We have a starter kit that has some basic communication tools and things like that. And then 2 things that are coming soon that we're really excited about. One is a more in-depth program for cyber leaders, where that person, non-technical person usually, could gain a little more knowledge on how to improve cyber readiness in their organization. And then the other one is really short interactive e-learning for employees. And this is something that we hope to be collaborating on with CyberHawaii. So that's all free content. If you go to our website, you'll see where you can get guides and tips or register for the program. So with that, off we go. So the first thing is the oh no moment. So if we think about the pandemic, one of the things that happened is there's been a huge increase in cybersecurity problems related to telehealth, specifically, 117% increase. Now, the other side is that we just ran a survey and we found that only 15% of healthcare professionals think that they and their colleagues have received sufficient training in cybersecurity. That's a concern, right? And then of course, the third, 56% of organizations have suffered a breach that involves a third party. So all of you need to think that it's not only that hackers might want to get at your company, they might want to get at your company to get to another company that you deal with. So with that, I'm going to turn it over first to Robert and then to Alan, just to comment on what you see here about this oh no moment and how you see this reaction to the pandemic. Robert?
Sure. Thanks, Craig. So, but prior to the start of the COVID situation, we really weren't using telehealth too much. We were trying to introduce it to a lot of folks, but we did have a Zoom software in place and a HIPAA compliant version of it so that we could make sure that we were following all the guidelines as far as security and protecting health information for our participants. But we have had quite a bit of training around general cybersecurity, as well as understanding how to protect HIPAA information. But we haven't changed that necessarily with the increase in telehealth cybersecurity. So that's something that we'll probably look at through this next year. But we do a onboarding program as people come on board as new employees that is specifically concentrated on our systems, including Zoom, including our EMR, so that everyone is familiar and knows how to use those products.
That's great. Alan, what jumps out to you in this oh no moment that we're all facing?
Well, I think part of the oh no is that, because of the pandemic, there was a rapid deployment of telehealth technology, just, to be able to continue to provide services to our patients, as well as, all other healthcare providers providing services to their patients. So with that rapid deployment, from a security standpoint, you could miss things. The other thing that contributed, I think, not in a negative way, but the government eased. They came out and said we're going to ease the HIPAA restrictions, requirements around telehealth, just so people could get the technology deployed. So, I know, I've talked with people that said, well, the government's eased it, so we really don't need to be concerned about, say, privacy issues or security issues.
Mm-hmm, mm-hmm. Yeah, no, I think that is a big issue there. So one of the things that I always like to share with our friends in Hawaii is this cartoon from the New Yorker magazine. So as you can see here, not only is everybody else shifting to remote, but crime is shifting to remote. So for health and safety reasons, we'll be transitioning to cybercrime, and that has absolutely happened. And a lot of cybercrime specifically focused on taking advantage of COVID and the fact that people are working remotely or working from home and remote and going back and forth. So the thing here, and we're going to do a quick poll of you because we want to know where you are, but one of the things that really jumps out to me about the telehealth ecosystem is how many players there are, and that there's lots of highly sensitive information involved. So you have a lot of players, a lot of highly sensitive information. that creates a really ripe field for hackers to be able to find ways to penetrate and steal information. So at this point, we're going to quickly go to a poll, and we want each of you to participate. And this very simply, Vivek is going to put up a polling question. And it's very simply, what is your role in the ecosystem? And then that's going to help Alan and Robert and I kind of get a feel for where you are, and then we can steer our discussion related to that. And one of the cool things I love the live polling too, because it gives all of us a chance to take a look at things as we evolve. And we'll be doing a couple other polling questions during the course of this. So we see right now, primarily we have healthcare providers, and then patient only is really coming in at second place right now. So Alan, let me start with you now, just in terms of the ecosystem and the different providers. What is your view within your organization? How do you think about the overall ecosystem?
When we look at telehealth, we look at it as any other system that we implement. So for example, we've done a risk assessment of the technologies that we deploy. Mm-hmm. And with telehealth especially, you're probably working with a third party, a vendor or a service provider that provides a service or provides the technology. So really taking a hard look at that third party service provider and vendor. And then, really focusing on things like the data. If there's data collected, if there's video collected, where is it stored? How is it maintained? The security around it. Looking at the connections, whether it be between patient and provider, provider and service provider. Are the connections secure and protected? How do people authenticate into the ecosystem? How do patients come in? How does the provider know that they're dealing with a real patient or the right patient? So the authentication.
We're going to get into some of the technology issues in a bit, and I really want to come back to a point you made about the connections, but we will get back to. I'm going to come back to you on that in a minute, Alan.
Okay, sure.
Robert, anything, your comment on the overall ecosystem and how the different players fit in before we move on?
Sure. The usability from the provider standpoint and the patient standpoint is one of the big areas of success or failure in each visit between the providers. So using common systems like Zoom, or as EMS has eased back some of the restrictions around using FaceTime or phone, although we would rather not use FaceTime or phone because of, phone because it's not video conferencing, and FaceTime because of the issues, security issues. Wow. But Zoom being ubiquitous now in businesses, a lot of our users, our patients are familiar with it. So it makes it a lot easier to actually connect. But it's that usability along with what Alan was talking about with security. And making sure to vet the systems before getting started.
Okay. So when we think about cyber readiness, one of the ways, and this is sort of a classic way to think about cybersecurity, is around the idea of people, process, and technology. And so with people, what are the behaviors that are required? And for providers directly, but also for admins, process. So what kind of changes in policies and procedures are required? And yesterday, and then technology, and what new technology is required. Yesterday, when we were doing the prep call, Robert and Alan, we talked about, in your case, in both of your cases, I believe, that you have providers that are working both from the office sometimes and from their homes sometimes, and connecting with patients. So talk a little bit about what kind of the dynamics that created about providing cybersecurity for the provider when they're working from multiple locations, including their home. Alan, I'll go to you first on this one.
Yeah, so, from a process standpoint, we try to set up standard workflows and processes, regardless of where they're connecting from. And then that's where the technology also comes in, because the assumption is that a provider could be working off of a home computer or off of a computer in their office. So from a technology standpoint, the security around all of that can be dependent on the specific device they're working on. It has to be something that is built into the software system or the service provider. So there's a lot of looking at that, and that's why I mentioned earlier risk assessment. And when we do that risk assessment, that's what we look at. How is that security actually deployed?
And Robert, let me have you focus on the people issue here. What are some of the changes that you had people had to go through, whether it's the providers or the admins, around the increasing your use of telehealth?
So early on in the before COVID, we weren't doing much telehealth at all. So we had Zoom, an implementation of Zoom, and we had telehealth capabilities through our EMR, but really no one was using it. It was kind of a novelty. But on March 17th, we made the decision to take the entire clinic virtual, and that would be both our Ornish program as well as our diabetes program. And virtually overnight, the staff had to get up to speed with how to use Zoom and the EMR telehealth capability, and in 24 hours, get ready to go.
Wow.
It was also a matter of reaching out to the participants or our patients to make sure that they were okay with being able to log in. So the first few weeks were kind of getting patients educated around how to log into a Zoom or our EMR telehealth, making sure that we were proactive around reaching out to them, making sure that they were comfortable with the software. And being able to log in readily. The other thing we had to do is change our scheduling habits, because if our patients weren't received by the provider within 2 or 3 minutes, they would figure that the appointment was canceled. So we had to be more, we couldn't overlap even a little bit. And the schedulers had to change what they were doing as far as how to put people on schedules to make sure that the provider was ready when the patient was ready.
That scheduling, that's a really practical issue. So how do you schedule now, and what kind of gap do you leave for the provider?
So our diabetes program is focused on patient education. So our appointments are about a half hour long. We don't overlap them though. So that half an hour is really meant to be 25 minutes or so with the patient and 5 minutes to transition to the next. So when we were in clinic, we would tend to overlap appointments to some extent, because we knew that patients would either be late or they would hang out in the waiting room. And some don't show up, but with telehealth, then you can't overschedule.
So when we think about it, and the other thing that it's interesting is that Alan, when you mentioned about the rapid shift to remote, we see that in every industry. And there was really a focus on business continuity and a kind of a lax attitude for a while on data loss prevention. And people had to focus really, and rightfully so, just on the continuity issues. So as we look at small business and at the healthcare industry, we often think about devices, data, and connections. And these three are kind of a way to get a feel for, especially in a remote environment. So Alan, you brought up the connection issue. So one thing that intrigues me is, of course, you have your providers, Did you do anything with the providers to give them like VPN or more secure connections? And then what do you do on the patient side? Obviously, you have no control over the patient side. So let's talk about connections a little bit.
Yeah. So depending on the specialty, we do provide VPN to some providers. Again, depending on the specialty, and typically that involves possibly the deployment of an HPH workstation or HPH software. But for most, it's been in terms of remote working, we use virtual desktops.
Okay.
So it's almost like you're transferring screenshots, if you will, as opposed to making an actual connection and moving data, over a line.
Okay.
So that's connected over HTTP as a secure connection, on the internet. And there's, a lot of technology behind that.
Right.
In terms of the telehealth, a lot of it is set up to run over the internet as opposed to VPN connections, and that way it's accessible, to the patient as well as to the provider. I should mention that we are migrating to using our EMR vendors video conferencing or telehealth technology. And with that, it's integrated into things like an individual's, personal
Your file.
Medical record, and then it's integrated into the access that physicians have into our EMR. So it's all tied together.
And so in that EMR situation, would the video, if I had a video call with a provider, that would be recorded and go into my medical record?
No, the call itself would not. It would be treated as a visit.
Okay.
And actually that, I don't know if we're going to talk about it later, but that's one of the points where recording the video it becomes an issue, because it's where is that video stored? And if it's stored other than on your servers, then all the questions about how it's protected and all of that comes into play.
Okay. Interesting. So we're going to go to polling question number 2. Vivek, if you could put that one up. And it's around the use of telehealth grows. How concerned are you about cybersecurity? And we see right now that really the majority is kind of leaning toward very concerned. And we don't have anybody that's not concerned at all. So as you continue to respond to this, I'm going to go to you, Robert, on this. Within your organization, and when you're talking to your patients, tell us a little bit about your overall concern around cybersecurity and kind of how important that is into your strategic plans.
Well, cybersecurity is always a concern because we are dealing with such high-level information for the patients, and this kind of information, if it were hacked into, would be detrimental to their health care. What we rely on really, though, is the systems themselves, whether it be our EMR or the systems that we're using for telehealth. We are relying on those systems to be secure. We do keep them up to date, including making sure that if there's a release of Zoom or Doximity or Teams, that we're all up to date on those releases, so that we can stay, patched and make sure that we're not open for hacking. But we can't control what the participants are actually, or the patients are reaching out to us through. So we have to rely on those systems to provide that security for us.
Yeah, that's a really interesting point there, because you really have no control over the patient side of cybersecurity. So everything has to be on your side, which is quite different from some organizations and how they can operate. So let's go to the next slide here. And let me close this out. So in terms of platform guidance, and this is something that we talked about yesterday, I'm going to start now with you, Alan, on this one.
Mhm.
When you went through selecting a telehealth platform, this is some of the things that we found in our research is to make sure it's consistent throughout the overall organization. Make sure or understand if it is in fact HIPAA compliant or not, to prioritize your needs, but also to think of the patient when selecting it. And then about the idea of uniformity and transparency, it just makes it easier in terms of training and familiarity with the technology. Tell us about how you selected a telehealth platform and any changes that happened because of the pandemic.
Yeah, so before the pandemic, we were doing some telehealth. It was for very specific services, and we used the technology for that. With the pandemic and the need to deploy on a wider scale telehealth, there was different vendors, a handful of vendors were looked at. Obviously, a key concern would be, would they sign a business associate agreement, at least indicating that they were aware of and, say that they've addressed the HIPAA requirements.
Mm-hmm.
So I think that's really important. There's a lot of video conferencing vendors out there that probably would not sign the business associate agreement. So that, we went through that. And then obviously looking at ease of use for our physicians as well as for the patients. So that went into play. We did select a vendor that we did deploy, and people started using. At the same time, we were in communications with our EMR vendor, and while they did not initially have a platform, given the situation, they were rapidly getting something ready to deploy, and it was our desire to go with our EMR vendor because of the integration with everything else that we're doing. So that's sort of the process we went through. I'm going to mention again, that the risk assessment I think is really important, and you do want to be consistent and select one vendor or service, not have multiple vendors or services, because you do need to do a risk assessment on each of them, and then you do need to monitor the security around them. So if you have one and focus on that one vendor or service as your telehealth platform, if you will, I think that's a lot easier to manage.
That's great. And Robert, you're in a smaller organization. I think your number of employees is certainly much less than Alan's organization.
Yes.
From a smaller organization standpoint, talk to us a little bit about your selection and then how you operationalized it or implemented it.
Sure. And we actually have two separate arms of our organization. One more concentrated on primary care at the Central Medical Clinic on the Koikini campus. And then we have our diabetes program, which is located in Kakako at the waterfront. So there's a little bit of separation between how these two separate arms practice as well as ages. So our physicians at CMC are generally quite a bit older than our providers down here at Waterfront. We had a need for telehealth for behavioral health around three years ago. So that's when we first started looking into having a telehealth platform. We at the Waterfront facility implemented Zoom for that purpose because of the HIPAA compliance and being able to sign that BAA with Zoom. And so we had that in place. Our EMR was just launching their telehealth capabilities around the same time as COVID. So that's still been a bit clunky, and it's a little hard to use from a patient access point of view. Due to the ease of use of the Doximity platform, that's been preferentially used by the physicians at Central Medical Clinic because it's easy for both the physicians as well as the patients, and their population is quite a bit older than our diabetes population as well. We do have Teams as well, which we use extensively within the clinics. But we have not implemented that as far as telehealth is concerned across everything, mostly around concerns around what that BAA with Microsoft actually covers. They tell us no that the implementation is HIPAA compliant, but there's some question marks in our minds. So I would like to see as well one platform being used across the entire organization, but understanding the ease of use between Doximity and Zoom. Those are the two products that are being used for the majority of services.
That's great. And that kind of gets us, and I think we've hit on this a little bit before, and so I don't want to spend too much time on this, but when you think about the selection of a platform and technology, of course, you've got providers, patients, admins, and third parties. And then are the issues that I would think of was ease of use, security, and HIPAA compliance. Is this basically, if you were telling, the people attending this webinar, if we're telling them to start to think about a platform and using a technology, would this be kind of how you would frame the discussion for them or the thought process? I'll start with you, Robert, this time.
Yeah, definitely. And the homework to do before implementing the platform is the HIPAA compliance and the security. The training, obviously, for all of the people that are using it. But in healthcare, that the patient is that unknown, right? So you don't know what technology they have, if they're using their cell phone. Some of our patients still have flip phones, so it's a little tricky to plan for the patients. So that ease of use becomes a huge thing. Some of our sessions with between provider and patient become 20 minutes of trying to get the sound to work and the video to work, and then you have a couple of minutes to talk about health, and then you're all done because you've only got that time frame. So in a busy practice where you're seeing 30, 40 patients a day, the last thing you want to do is spend the majority of your time trying to actually connect with the patient.
And I'm sure your doctors are not the best people at tech support anyway. So
and we do have tech support available even with our smaller organization, but even it's just clunky to have another person come on and try to troubleshoot what's going on.
Right. Alan, anything to add before we move on?
Yeah, I was going to comment that, and this isn't related to HPH, but my dad is, he's a veteran, so he goes to the VA for a service. And what the VA has done, and I don't know if others, have experienced this, but they actually set up an appointment for a video call, and then they reach out the day before, and actually the morning of or the day of, and they have a technical person work with you. In this case, he worked with me because my dad is, senior and isn't tech savvy. So they worked with me to set up the call, get everything set up, and we tested it. And then they had the physician join. So I thought that was an interesting approach. Took a little bit more time to get things prepped, but it made the quote visit unquote between my dad and the physician a lot easier.
That's a great idea. That really makes a lot of sense. So we're going to move ahead now to some basic steps to reducing cybersecurity risk. Now, some of these are applicable to telehealth, and actually a lot of them are not only applicable to telehealth, but more broadly to organizations. So here's a question we want to start off with here. I know exactly what to do if there's a cyber attack on my work computer, tablet, or smartphone. And so far we see quite a split, kind of a lot of people in the middle here. And this is among an audience of people that actually chose to participate in a cybersecurity webinar on telehealth. If you do this, this is a question to go in your organizations. To all of you on the call, walk around your organization or start your next Zoom call with people in your organization and ask them this question. And it's really, really valuable information for you to understand if people know what to do. And what you'll find, I think, is that most of them are going to be a 2, maybe a 3. But you're going to find it in your organizations, I would bet very few 4s or 5s. So with that, we're going to go here. When we talk about cyber readiness at our organization, what we did is, and we work with MasterCard and Microsoft, and as 2 that really helped us to kind of understand the small business mentality and then how to really help them. One issue, we focus on 4 core issues: passwords and authentication, software updates, phishing, and then the use of USBs and removable media. So what we found is that if small organizations get better at these 4 things, they're going to radically reduce their likelihood of a cyber incident. Then, even with that, so we're focused on prevention, but then beyond that, you have to assume that there could be an incident. And it's just like with a fire. We all have at least a basic idea of what to do if there's a fire in our building. And companies have to have some kind of fire response plan in place. So that's the other piece to it. So cyber readiness is about prevention by focusing on these core 4 issues, and then having everybody know what to do at the most basic level if there is an incident. So that's what we focus on. Our goal for organizations is to help you create a culture of cyber readiness that spans all the people in all the locations. And what we see increasingly is that now has to span multiple locations and multiple devices, because most people are either working remotely or a hybrid, where they're working at home and at the office. So that makes everybody's life more difficult from a cyber standpoint. I could be working at home today, at the office tomorrow. Because I'm at home, I forgot my computer, my work computer. I could be using a personal a desktop computer. A host of things happen there. So that's really what we focus on. I now want to go over some tips, and then I'm going to turn this back over to Alan and Robert on this. When we look at the core 4 issues, we really advocate the use of 15-character passphrases and multi-factor authentication. There's a stat that's really remarkable. If your password has 8 characters, regardless of how many special characters and all that, if hackers put a lot of computing power against it, they can crack it in 3 minutes with 8 characters. If you go to 13 characters, it's 30 million years for them to crack it with the same computing power. So every character you add makes it much, much safer. We say 15 because that is a longer pass, and we say passphrase, so that you can use a line from a song, from a TV show. You don't need to then use, if you don't want to, you don't need to use special characters, and you don't ever need to change it unless it's been hacked. And the likelihood of it being hacked is really low. So one of the most annoying things for me is having to change a password every 3 months. When you get the damn alert. And for me, it always happened when I was getting off an airplane or on an airplane. I'd go to log in and I'd get this stupid alert saying your password's about to expire. You got to reset it. So passphrases, think about 15-character passphrases. Phishing. Here, there's been such an increase in COVID-specific phishing, both by email and text. Huge increase in text. So the other thing here is you should be providing your employees with frequent updates on this. Quick tips. Start your meetings or your Zoom meetings with something about phishing, just to keep it front of mind for people, especially now with people working from home, where you might have kids in the other room, where they're being homeschooled and your attention might be a little divided. The hackers know this, and they're taking advantage of this type of opportunity. Removable media. If people, now it's probably less of a concern in the telehealth here because you do have the EMR and people tend to be accessing that. But in a lot of industries, people are still moving documents from place to place on USBs or portable hard drives, another high risk area. And then finally, software updates. All devices should be updated. So if you're using a personal computer from home to access work information, you got to make sure it's updated, because slow updates are one of the biggest gateways for hackers to be able to penetrate into your computer and then spread into the broader network. Alan, I'll start with you on this one. What do you want to tell people, tell our audience about here? What are some of the tips that resonate with you?
Yeah, no, I agree with all of it. With regard to what you have on the password line, multi-factor authentication, especially now, as we've discussed, we have a lot more people working remotely or accessing systems from remote locations. Multi-factor authentication, is almost a must, I would say, in this day and age. And the point I wanted to make about the USB and removable media use, a HIPAA requirement is that devices that contain PHI be encrypted. So if you have removable media, especially, it's portable, can be stolen, can be misplaced. Be sure that the device is encrypted, so the information on it is protected, especially if you have PHI on it. And yeah, phishing, that is, I know one stat I saw, they said 90+% of attacks are coming in. The vector is phishing emails. And now, as you said, we're seeing texting. We're also seeing a combination of voice calls along with emails. So just need to be really cautious about that. And patching is, yeah, I mean, you need to patch. More and more the hackers are taking advantage of unpatched machines, devices as the initial entry into a network, especially if you have devices exposed to the internet, exposed to the outside. Be sure that those devices are patched, because you can actually do a scan and look for unpatched devices connected to the internet, and that's what hackers are doing, and that's what they're attacking.
Mm-hmm, mm-hmm. Robert, anything you want to add on this slide?
Not too much as to add to what Alan has said already, but we do frequent phishing exercises. We're actually part of a larger company called CyberHawaii, and they do frequent emails that are internal phishing emails to make sure that our team is staying on the up and up on the latest phishing strategies. So if you get into one of those emails, then you have to go to some mandatory training to refresh it. And phishing is part of our compliance training on an annual basis as well. Otherwise, USB, we don't use. I'm probably the only person in the organization that uses USBs, and that's due to non-PHI sort of stuff that I need to store on an external drive. We're using, the EMR and SharePoint and things like that rather than external drives. But the software updates are super important.
Yep. Craig, if I can make another comment.
Sure.
One of the biggest threats to healthcare right now, in fact, there was a advisory put out by the FBI and the Department of Health and Human Services about the threat of imminent and credible threat against healthcare of ransomware attacks. So something else I'd add to this list is backups. Mm-hmm. Be sure your systems are backed up and they're stored off of your network. So be sure there's an air gap between your network, your computer systems, and the backup that you have. And that's becoming more and more important, especially as ransomware is growing as a threat to the industry.
Agree completely. And in fact, in the incident response piece, that's where we cover that, Alan, is in the incident response piece. It's critical. We actually did a decision tree for ransomware for Department of Homeland Security. And the best protection against ransomware attack is a tested backup. Because that way you can really ignore the attack to a certain extent, because they don't have data that you don't have. They're not holding anything hostage that you can't recover. So Now we did have a question come in. Somebody said that my comment about using a lyric from a song directly um, is not a good idea. So to that point, I agree. If you're using like a well-known lyric from a song, if you insert or make some changes in it or alteration, it is going to make it a lot more secure. So I appreciate that comment that came in, and I do agree with that. So ways to develop good cyber habits. And at CRI, we really focus on people and process side of it, and we really focus on human behavior is really the key that we focus on. Of course, technology is critical, but we really in our work focus on that human behavior aspect to a great extent. So here's our last polling question. Our healthcare providers and employees clearly understand good habits regarding cybersecurity and data protection as they work remotely or rotate between remote and company locations. So let's see if you strongly agree where we stand on this one. And we're getting at the habits. What do people do on a daily basis? And while this is coming in, you know, a lot of organizations around the world that I've worked with end up with what I would call a workaround culture. So they have good policies in place. They've done a little bit of training, but ultimately the people are trying to do their jobs and they consider cybersecurity or data protection as ancillary to their job. And so they end up finding a way to do their job efficiently and kind of put the cybersecurity or data protection issue aside. That's what I call a workaround culture. And it's not bad intent. It's really just, it's a way that it ends up that way. So let's see where people stand. So here we have the bulk of people here in a 2 or 3 in terms of agreement. I think we can move on from this. I'll go, Robert, let me ask you, what do you see in this before we move on?
Well, we provide the cybersecurity training as part of our compliance training, and that's on an annual basis. And you know, I would say that we have the best intentions of keeping everybody up to date, as well as they should be about what to do and not be part of that workaround culture. But it's a constant reminder, and that's where the phishing emails that are done through our IT support team come into play, because it keeps people on their toes, keeps it top of mind that, you know, there are people out there that have bad intentions and trying to get into systems, and that they should need to be aware of the cybersecurity on their own computer.
Alan, what about you? What do you see here around the idea of habits? And do you have a way to check? I know the training takes place, but do you have a way to check people's behavior?
Well, we have a lot of monitoring systems, you know, so as you said, if people try to get around some security, you know, if we can't prevent it, you know, my hope is we're able to at least detect that something is happening and then follow up with that individual in our organization. And I think this is pretty common practice now. You don't depend on just one security control. You have layers of security control. So if someone gets around one, you know, there's something else that they'll be either stopped by or will be detected. And you know, then we can go out and talk to them. The other thing that we're doing is we're looking at different modes of communicating. So we also do phishing. We do. In fact, I was on a presentation to one of our medical centers managers and directors just before this about security. We do videos on security that we share. We do mandatory annual, you know, security training. So we're trying to get the word out in different different types of media because people learn different ways. So
That's a great point. That's a great point. And so when we think about culture in an organization, you know, we're trying to get to this culture point up here, but ultimately culture is the result of behavior in an organization, and an organization hits a tipping point where enough people behave a certain way that that becomes part of the culture. And if you break down behavior, what you're trying to do is to develop habits for people. So the example I've been using lately is the idea of seatbelts in the car. So 20 years ago, people didn't wear seatbelts, right? Now it's habitual. My kids, they're all in their 20s. They get in the car, they put the seatbelt on. They actually just put the seatbelt on. It is such an ingrained habit for them. The technology helped to support the habit in the beginning because if you don't put it on, it beeps, beep, 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 beep. So there's a technology piece, but the habit then is really what we're trying to do with people in cybersecurity. So like getting in the habit of using multi-factor authentication, getting in the habit of updating your software on your personal devices or any device that you have control over. So that's one of the ways that CRI that we kind of think about it is culture is made up of behavior, and then behavior is made up of people with having good habits. So here we get to, actually, let me go back because we have a minute on this. Yeah, let me ask you, I'll start with you, Alan, on this one. What do you think about in your organization around this issue of culture, behavior, and habits? How do you see this fitting together to try to, in your organization?
Yeah, no, I agree. You know, we are trying to build a culture of security. In fact, you know, at the end of almost all my presentations that I make, I point out that you are a critical security control for us. You know, every employee of HPH is a critical security control. You're a gatekeeper that can let the hacker in, and all it takes is one, right? So I totally agree, and that's what we're trying to do. You know, we're very fortunate that we have support of the of top leadership in the organization, and you know, we're trying to get this message across.
Robert, and what about from your point of view?
Pretty much the same, very similar message. What Alan was saying, that every employee is a primary gatekeeper. We're a much smaller organization, so it's a bit easier for us to be able to actually get buy-in and make sure that everyone is following those habits and behaviors to have that culture throughout.
That's great. So for the audience here, so one of the things that we have at CRI is we do have policies. So if you sign up for the program, there's free policy templates that you can use, and actually a playbook that you can use to put together a cyber ready playbook that has policies in it. But one of the key differences when we see a cyber ready culture versus this workaround culture, in that cyber ready culture, the policies were developed with inputs from different departments and people with different skill level. It wasn't something where the CISO like wrote it and pushed it out. They tend to use easy language and a minimum of technical language. And then as part of that, getting the input, they tried to make sure it was practical for people to follow and do their job. Because all of you are in business to deliver a service or a product. You're not in business to be cyber secure. However, being cyber secure has to be part of how you operate. So that's why you want to get that input and make sure that there's some consensus. So you don't push something out at people and then they say, my God, Robert, I can't do this and do my job. Therefore, I'm going to do my job and ignore this cybersecurity policy. On the flip side, the workaround culture, often what we see is impractical policies. Like I saw one company where they had a no USB policy, but when we looked into it, all of the salespeople, sales engineers were getting drawings and specs from potential clients on USBs. So they're all bringing USBs back. They knew it was against the policy, but the organization hadn't really provided an alternative. There's insufficient training. And then the other thing here is it's okay for some people to ignore the policy. Now, in a health environment, my guess is some of the doctors might feel that the policies don't apply to them. I've done a lot of work with law firms, and senior partners in law firms many of them often feel that the policies don't apply to them. They apply to everybody else but them. So that's something that you need to think about, is to make sure that the policies are consistently applied to all people. And then this is the last slide, and I'm going to just quickly talk on this because I would like to offer Alan and Robert a chance to wrap up. But telehealth will require new habits of your people, changing behavior. Think about the idea of using frequent short communications. Design your training to go from the idea of awareness to gaining commitment and then teaching how to. Don't skip any of those steps. And with that, I'm going to open it. I'll start with Robert this time. Just any wrap-up comments that you'd like to make to help people that are attending this on, like, some key takeaways for them.
So I think the people portion of things is one of the most important things in a healthcare organization to really pay attention to, and understanding that the no matter what we do as far as telehealth is concerned, we do have those patients that are the loose, the unknown, but making sure that the providers, whether they be physicians or nurse practitioners or behavioral health specialists, all are aware of the security risks and using the systems correctly to make sure that everything can be done as securely as possible.
That's great. Alan?
Yeah, so on top of, I think, there's a lot of good nuggets that we discussed here. On top of that, I'd suggest that as you look at securing your organization and deploying security, always look at the risk. Practically, it's probably cost prohibitive and impossible to have a totally secure environment. However, if you say, well, let's look at where we have our biggest risks and start addressing those areas, then it becomes, somewhat doable. And there are some things that you may say, well, it's impractical for us to do that because we won't be able to work, or it'll make the work very difficult. Then consciously accept that risk and make sure that everyone in the organization knows that. So I guess that's my comment.
That's great. The whole idea of a risk-based approach makes a lot of sense. So that's it. We've come to the end of the hour. Again, we really appreciate your time, Robert and Alan. Jill and Jen, it's always great to work with you, and we hope to do more of these next year and keep it going. For all of you that attended, feel free to go to our site, register for the program, access our content, and if you want, reach out to me and ask me any follow-up questions. I'd be happy to get into an email dialogue with all of you or any of you. Thanks very much. Take care, everybody. Bye-bye.
Thank you.
Thank you.